CVT was the first organization in the United States created specifically to extend rehabilitative care to survivors of politically motivated torture. We pioneered an interdisciplinary model that enabled survivors to heal from the wounds of torture and rebuild their lives. Over time, in addition to expanding our work internationally, we've invested in building the capacity of colleague organizations across the United States and around the world. And we've made key contributions to ending the use of torture and cruelty. Torture is a powerful weapon that is actively used or condoned in more than 100 countries. It creates apathy and fear because it destroys individuals and sends them back as an example to others of what will happen if they work for democracy, or religious freedom, or women's rights, or labor rights, or the environment. Tens of thousands of lives are destroyed by torture every single year. CVT rebuilds the lives of people who have survived torture and severe war-related atrocities in the United States and around the world. We're building the capacity of colleague groups in the U.S. and abroad through technical assistance and training, and by creating funds to sustain their work through our advocacy efforts. We're working against torture and to advance human rights. Our ambitions are limited only by available resources. Rebuilding the lives of torture survivors is complex work, and our highly trained and deeply experienced clinical staff are experts in this emerging field. We recover the lives and leadership abilities of people who are disabled by perpetrators of torture. Not only do we help people function independently in the world, but we also generate improved healthcare outcomes, and we believe we also generate reduced healthcare costs. We're effective because we place a very high priority on strategic thinking and planning. Our strategic plan doesn't sit on the shelf. It's updated annually and forms the basis of organizational, departmental, and individual work plans. We also believe in the imperative of partnership and collaboration. Every CVT program and project has a tight focus on what we do best and how we can leverage our expertise through partnerships with others. Finally, we're effective because we're good stewards of our donors' support. I encourage you to visit our listings on the Better Business Bureau's Wise Giving Guide or Charity Navigator. CVT has a strong focus on results. We invest in monitoring and evaluation and measure the success of all our programs. In our direct services programs, we measure our clients' physical and mental health improvement, as well as their ability to function well in the world, at 3, 6, 9, and 12-month intervals. I'm proud to report that we document significant improvements in both health and functionality. In our training and capacity building projects, we document impact through self-reported changes in attitudes and behaviors through pre- and post-event testing. International agencies that fund our work tell us it's our commitment to monitoring and evaluation that makes the difference for them. It was once thought that after people were destroyed by torture, nothing could be done for them, and that all efforts should be directed towards preventing the next person from being tortured. But with our colleagues in the U.S. and abroad, we've proved that wrong. People can recover from the wounds of torture. They can reclaim productive lives as teachers or doctors or nurses or dentists or journalists. They can be leaders again. They can get married. They can have children. They can lead healthy and productive lives, the same kinds of lives that people all over the world aspire to lead. We extend rehabilitative care to thousands of clients each year, people who endured brutal torture and severe war-related atrocities. Let me tell you about two of those clients. Several years ago, we had a client from Bosnia, who I'll call Amina. In her early 40s, slight of build and soft-spoken, she participated in a meeting with a visiting United States senator. When the senator asked her about her experience at CVT, she looked him in the eye and said, "They dug me up from my grave." And not long ago, a young woman from Cameroon, who I'll call Della Eden, said this to one of our clinicians: "You have a very hard job because it's your job to put the soul back into the body." Torture is so repugnant that people actively don't want to think about it. That's a big challenge in our communications and fundraising programs. How to engage people in our work when the very concept of what we do is something they just don't want to consider. So we focus on hope and healing and on our clients' remarkable transformations. Another challenge is the notion that torture is an effective interrogation technique. Nothing could be further from the truth. We've been caring for torture survivors since 1985, and we know from our work that people will say anything to stop the torture, whatever they think the torturer wants to hear. That's why senior military and national security leaders agree with us. The last thing they need when good and timely information is critical is to be sent on a wild goose chase. Torture isn't just immoral, it makes us less safe. If we had additional resources, we would extend care to a larger number of torture survivors. We'd expand our work in the U.S., and we'd expand it abroad. Healing torture survivors is both humanitarian and strategic, and the need for what we do in the world is urgent. We'd very much like to strengthen our advocacy work, and in particular to strengthen the link between direct services, the rehabilitation of individual survivors, and torture prevention. We'd like to produce reports that contain demographic and diagnostic information, as well as type of torture information for key policymakers on national and international levels.